Hello. There we go. Hello, everybody. This is Dr. Tyler Evans coming at you live with the Facebook research moment. I think, maybe you missed that. We'll restart here. Hello, everybody. This is Tyler Evans from Arete Chiropractic coming at you live with the research moment. Today, I want to talk about cone beam CT. What is cone beam CT? Why is it important? Why, if you're a chiropractic patient, if you're an upper cervical chiropractic patient, might it help? Our office has been one of the pioneers of this technology in the profession, and why we have looked into this technology, why we embrace it, is that for the amount of time, for the amount of information that you get from this technology, it dramatically helps improve outcomes and helps get patients better results. And what is this technology? So cone beam CT, computed tomography, so a CT scan, a computed tomography scan, is a scan that goes around a patient many times, spinning very quickly, going around, maybe 50 times over a few minutes, maybe even more than that, maybe hundreds of times. I'm not actually certain on that, but what I do know is it has a very high radiation dose, roughly 100 times higher than cone beam CT. And so when you talk about the value that you get from a CT scan, 3D information, versus an X-ray, it makes sense that if you could get that 3D information in a much smaller dose, then that would benefit patients, because 3D, we know that when you're looking at structures in the head and the neck, you need a 3D image to get the best information. And when it comes to specificity in the upper neck, the top two neck bones are the most variable, most malformed, most easily compromised joints of the spine. Therefore, it makes sense that 3D would just be the way that you would want to go. Now, in terms of other technologies out there, there is MRI, which looks mostly at soft tissue, but it's really hard to see the proper bony landmarks with an MRI. So when it comes to the imaging modalities out there of choice, cone beam CT is the real winner. Where did cone beam CT come from? It's been around for roughly 20 years now. The dental profession developed it and brought it into use and has been using it since about 2000. And why it helped them was because they take those bite wings, they want to look at periodontists, endodontists want to look at the roots of the teeth and make sure that they align things properly when they do implants, and that dramatically improved their outcomes. And so they saw the value and the benefit of using this 3D X-ray technology. And so it just kind of spilled over, and the technology has now been adapted for extremity X-ray in hospitals. You just stick your arm in, it takes 2 swipes, and you've got a 3D image in seconds, versus sitting in an old CT machine and it spins around many times, the radiation dose is a lot higher, all that stuff. So it's a very valuable technology, and you don't want anybody putting a force into your neck without seeing what's going on. And that's what we're doing here, is we're measuring in 3D how the bones have moved so that we can get them back precisely in the position and place that they need to be to take the pressure off of the nerves. And in the upper neck, we're talking about some of the most important nerve cells in the body, some of the most important neural components of the body. And so we want to be very careful, we want to be very safe, and 3D information allows us to be able to do that better than we've ever been able to do before. Basically, before with X-ray, it's a great technology, and not saying anything about doctors that use X-ray, but if you can get a cone beam CT, it's going to give you more information. Basically, in the past, we were taking 3 different pictures or 4 different pictures and trying to come up with a 3D idea. Now we have it. We just scan. It takes less than 60 seconds. The beam is a cone-shaped beam rather than a fan that spins around and stacks images like this over time. It's one beam and it goes around in a circle like this, and it's pulsed. So it takes pulsed images. It takes a shot, takes another shot, takes another shot, and then it puts them together, and the computer does all the heavy lifting. The computer does all the work on making the image clear. As my camera isn't clear there, it makes the image clear and removes distortion. I mean, it removes movement. It's just fantastic technology. And what that does when you're talking about putting vertebra back in the right place, precise measurements need to be spot on to get the vertebra back within millimeters, back into the right spot. And so when we talk about cone beam CT, the spatial orientation in 3D, it's just beautiful. It allows us to do so much more than we used to be able to do. And so this paper today, cone beam computed tomography, basics and application in dentistry. This is an overview of basically what cone beam technology is. I've read many papers like this over the years, but I haven't read one quite as easy to understand and as well documented and as well explained as this one. Kind of well-rounded. And it just talks about, the radiation dose difference from CT to cone beam CT. We're talking about, maybe a few days worth of background radiation, which is about 10 microsieverts of background radiation that we get every day. A cone beam CT might be, depending on the scan, the field of view, the size of the scan, so the thickness of the scan as it goes around might be roughly between 2 to 3 to 5 to 6 days of background radiation, whereas a CT scan might be 100 days of background radiation or more, 200 days. So, it's really important that we delineate the difference between a CT and a cone beam CT. They're night and day difference. They are not the same thing. So it's a fantastic technology. It gets 3D information. It allows us to literally take a slice anywhere through the column of data, any way, at any angle. We call that oblique slicing. It talks about this in this paper that says that oblique slicing is a unique feature of cone beam CT, whereas in the past everything was orthogonal, meaning just like this. So you could only go up and down in this direction and back and forth in this direction. Now we can turn it and slice it and go any way and take any x-ray that we want at any thickness. So we can make it thick so that you can see the length of the spine through it, or you can just do a really thin slice and see what's going on right in this thin slice right in the middle of the spine. That allows you to see a lot of different anatomy, things that you wouldn't normally be able to see with an x-ray. You can pick these up immediately on cone beam CT. So anyways, for the value of the technology, the cost of the technology, it is just head and shoulders above anything that we've had in the past. And this paper is a great paper. It was produced in 2017 in, I believe, Istanbul, the Journal of Istanbul's University of Facial Dentistry, I believe, and came out in 2017. It's a great article. And if you have questions, definitely let us know. Give us a call. We're happy to answer those questions. Tyler Evans, Arete Chiropractic, and we're in Portsmouth, New Hampshire. If you have questions, look us up. Give us a call at 603-380-9184. When it comes to getting the head back on straight and balancing the spine so that the brain is healthy and the nervous system is healthy to bring life back, to heal problems, 3D imaging is without a doubt the best way to do that, and cone beam CT is the best benefit cost analysis ratio in chiropractic terms for doing that. And MRI is great too, but again, soft tissue, not hard tissue, and it can be very helpful. All right, hope you guys have a great day, and we'll talk soon. Oh, and our phone number here is 603-380-9184. That's 380-9184, and we'll talk soon. Take care.